If you've ever woken up and looked down to find your ankles puffy, your skin tight, and your favorite shoes suddenly too small, you already know exactly what I'm talking about. That heavy, swollen feeling in your legs first thing in the morning isn't just annoying, it's your body sending you a signal. Now, here's something most people don't realize. While you sleep, fluid doesn't just sit still in your legs, it actually pools. And depending on how you sleep, how active your circulation is, and a few other factors we're going to talk about today, that fluid can build up overnight and leave you feeling stiff, swollen, and uncomfortable before your day even starts. I'm Dr. Alan Mandell, and welcome back to Healthy Aging America. Today, I'm going to show you 3 simple exercises, and all you need is a single pillow that you can do right in bed tonight to help your legs drain naturally while you sleep. We'll start simple, but stick around because exercise number 3 is the one most people have never heard of, and it might end up being the most important one of all. Let's get into it. Before we get to the exercises, I want you to understand why this happens, because once you understand the mechanism, these movements are going to make a lot more sense, and you're going to actually want to do them. Here's the thing about your circulatory system. Getting blood down to your legs is easy. Gravity does that work for you. But getting blood and fluid back up from your legs to your heart, that's a much harder job. Your veins have to fight gravity every single time, and they rely on 2 main helpers to do it: the pumping action of your calf muscles and a series of one-way valves inside the veins themselves that keep blood from flowing backward. Now here's where age comes into play. As we get into our 60s, 70s, and beyond, those vein valves can weaken. The walls of the veins can lose some of their elasticity. And if you're sitting for long stretches during the day, watching TV, working at a desk, traveling, your calf muscles aren't pumping the way they should be, so fluid has a harder time making the trip back up. Then, nighttime comes. You lie down flat, and for the next 7 or 8 hours, your legs are essentially still. No walking, no calf pumping, very little movement at all. Fluid that didn't get a chance to drain during the day continues to settle in the lowest points of your body, which, when you're lying flat, often means your ankles, feet, and lower legs. There are a few other common contributors I want to mention because they may apply to you. Certain blood pressure medications can cause fluid retention as a side effect. Eating a higher sodium meal in the evening can cause your body to hold on to more water overnight. And simply being less active during the day, which happens to a lot of us as we age, means your circulatory pump just isn't getting used as much as it used to. I do want to pause here for an important safety note, because this matters. The swelling we're talking about today, mild, gradual puffiness that affects both legs and tends to improve with elevation, is common and usually not dangerous. But if you ever notice swelling that comes on suddenly, affects only one leg, or is accompanied by pain, redness, warmth, chest pain, or shortness of breath, that is not something to manage at home. That could be a sign of a blood clot or a heart or kidney issue, and you need to see a doctor right away. Please don't ignore those signs. Okay, with that said, for the everyday common swelling so many of us deal with, let's talk about how a single pillow can make a real difference tonight. The first exercise is the foundation everything else builds on, and it's probably the one you've heard of before, but I'd be willing to bet you're not doing it quite right. Here's how it works. Lie on your back in bed and place a firm pillow, or better yet 2 pillows stacked, underneath your calves, not your feet. You want your ankles to end up roughly 6 to 8 inches above the level of your heart. For most people lying flat, that means the pillow should lift your lower legs to about that height. Why does the placement matter so much? If you put the pillow only under your feet, you create a sharp bend at the ankle that can actually compress the very veins you're trying to help. By placing the pillow under your calves instead, your whole leg forms a gentle, supported slope from hip to ankle, which allows gravity to do something it normally can't do during the day. It can finally help fluid flow back toward your heart instead of working against it. This is pure physics. For 16 plus hours a day, gravity is pulling fluid down into your legs. By elevating your legs above heart level for even part of the night, you're giving your circulatory system a few hours where gravity is finally on your side. I recommend holding this position for at least 20 to 30 minutes before you fall asleep, though many of my patients find it comfortable enough to maintain through much of the night. If stacking pillows under your calves feels unstable, a wedge-shaped pillow works beautifully here too, and you'll find those are inexpensive and easy to find online. One more tip: if you tend to roll onto your side during the night, that's completely fine. Just bring the pillow with you and place it between your knees with your top leg elevated slightly, which, by the way, leads us nicely into where we're headed with exercise number 3. Now that your legs are elevated, let's put that calf muscle pump to work. Because remember, your calf muscles are sometimes called your body's second heart. Every time they contract, they squeeze the deep veins running through your lower leg and push fluid upward, back toward your heart. With your legs still elevated on the pillow, point your toes away from you, as if you're pressing on a gas pedal. Hold for 2 seconds. Then flex your toes back toward your shins as far as comfortably possible. Hold for 2 seconds. That's 1 repetition. I recommend doing 15 to 20 of these slow, controlled pumps. You don't need to rush. In fact, slower is better here, because it allows each muscle contraction to fully engage and then fully release, which is exactly the rhythm that encourages fluid movement. If you'd like to make this even more effective, try adding small ankle circles between sets. 5 circles clockwise, 5 circles counterclockwise on each foot. This adds gentle movement to the joint and surrounding muscles without requiring you to get out of bed or strain anything. What I love about this exercise is that it mimics in a very small way the same muscle activity you'd get from walking, except you're doing it lying down with your legs already elevated, which means you're stacking 2 circulation-friendly actions on top of each other at the same time. All right, here's the one I promised you at the beginning. This is the exercise that tends to surprise people because it's rarely talked about, yet in my experience, it can make one of the biggest differences of all 3. Take a pillow, a smaller one works best here, and place it between your knees while lying on your back or on your side, with knees gently bent. Now, simply squeeze your knees together into the pillow, hold for 3 to 5 seconds, and release. Repeat this 10 to 15 times. Here's why this one matters so much. When you squeeze your inner thighs together like this, you're activating the adductor muscles, the muscles along your inner thigh. But more importantly for tonight's topic, you're also engaging tissue that sits very close to your lymphatic vessels in the groin area, which play a major role in draining excess fluid from your legs. Think of your venous system as the highway that carries fluid back toward your heart, and your lymphatic system as a second, quieter network working right alongside it, helping to clear out excess fluid your veins didn't fully manage on their own. Unlike your veins, your lymphatic system has no central pump at all. It relies entirely on surrounding muscle movement to push fluid along. which means if those muscles never engage, that fluid simply has nowhere to go. This little pillow squeeze gives those lymphatic pathways exactly the gentle muscular activation they need, right at the point where major lymph nodes are located. It takes less than 2 minutes, and it pairs perfectly with the elevation and ankle pumps you just did, because now you're supporting drainage at both ends of the leg, the ankle pump working the lower leg, and the pillow squeeze working higher, up near the hip and groin. I'll tell you honestly, of the patients I've walked through this routine, the ones who add this third step are almost always the ones who report the biggest difference by morning. Don't skip it just because it feels like the simplest of the three. So here's how I want you to do this tonight. Start by lying down with your calves elevated on a pillow for that 20 to 30 minutes. You can read, watch something on your phone, or just relax. While you're up there, work through 15 to 20 ankle pumps. Then, before you drift off, switch to your side, place a pillow between your knees, and do your 10 to 15 gentle squeezes. 3 exercises, 1 pillow, maybe 10 minutes total, and you're giving your circulatory and lymphatic systems real support during the exact hours when they need it most. I want to leave you with a few quick additions that pair beautifully with these exercises. First, watch your sodium in the evening. A salty dinner is one of the most common and most overlooked causes of next morning puffiness. Second, try to stay hydrated throughout the day. It sounds backward, but adequate hydration actually helps your body manage fluid balance better, not worse. Third, if you know you'll be sitting for long stretches in the evening, try to stand and walk for even 2 or 3 minutes every hour. It keeps that calf pump engaged before you ever get to bed. And finally, if side sleeping is more comfortable for you, that pillow between the knees we just talked about isn't just for the squeeze exercise. Sleeping with it there all night helps keep your hips aligned and your upper leg gently elevated, which can continue supporting drainage even after you've fallen asleep. I want you to remember something. Swelling in your legs doesn't mean your body has stopped working for you. It means your body needs a little extra support to do what it's always done. And the beautiful thing is, that support doesn't require expensive equipment, a gym membership, or hours of your time. Sometimes it's as simple as the pillow that's already on your bed. Try these 3 tonight, and tomorrow morning, take a look at your legs and see how they feel. I genuinely love to know. Leave a comment and tell me whether you noticed a difference. If this video helped you, please give it a like, subscribe to Healthy Aging America, and share it with someone you know who could use a little relief tonight. Take care of those legs. They've carried you a long way, and they deserve it. I'll see you in the next one.